Don Lee, President of the Texas Essential Healthcare Partnerships. Thank you so much. So you and your organization are sounding the alarm about what will happen if the 1115 waiver isn't restored. How bad would that be for the hospitals that you represent?
Oh, actually, we believe it'll be catastrophic, not just for the hospitals, but for all Texans, because we all depend upon hospitals, and it could become a cascading failure where enough hospitals fail that it puts load and demand on other hospitals so that they start to fail, and you have a broken healthcare system. That's that's how important the funding that comes to the 1115 waiver is to Texas.
And so we're talking about uncompensated or charity care for the hospitals. Is that right? Care that they provide to people who don't have the insurance or the means to pay for it. Is that right?
Yes, sir. We're talking about part of the Medicaid program, and we have a very limited Medicaid program here in Texas. We do not enroll all that great a number of Texans in Medicaid and pay for their health care that way. So this is an avenue that Texas and the federal government has devised to get the necessary funding for our healthcare system to Texas without enrolling as many folks in Medicaid.
And so if it's not replaced, and I understand there's still time, it doesn't run out until October of 2022, is that right?
Yes, sir, that's true. There
And
are some details, though, that actually start to have impact in just a short 3 months.
what will happen then?
So there's about $330 million of very important mental health care funding for mental health care services for the poor that will be lost starting in September of this year if this waiver is not extended.
And so I guess my question to you is, before you said this could have a catastrophic impact on hospitals. So are we talking about hospitals in more rural settings closing, or are you talking about even in our area, because you represent Baylor Scott and White, Methodist, Tenet, and Texas Health Resources? What would be the impact that people would see?
I think in an urban area, the first thing they're going to see is the hospitals are going to all of a sudden have budget problems. They're going to start to take actions. That could include increasing the cost for insured patients. It could mean going to the local governments and state government and saying we need to find state tax revenue to replace this. So there's going to be pressure on taxes. There's going to be pressure on insurance rates. In rural areas, you're probably first going to see the hospital failures, and that could start cascading into the urban areas. And I think there could be some facilities in urban areas that would need to be shut down. You know, those hospital systems run numerous hospitals throughout the DFW area, and they may not be able to keep them all open.
Um, I know that your organization is saying that this could be disproportionately harmful to the DFW area hospitals. Why is that?
Well, there's a large number of uninsured and underinsured folks who need this charity care assistance that the 1115 waiver provides in the DFW area, and especially the urban core.
And as far as, I mean, when we talk about this waiver, I know your organization is not political; it's more focused on patients. So talk to me a little bit about that, as far as what it is that you're doing to try to get the waivers restored.
Well, we're simply communicating the facts to all the decision makers that are involved in this. And I'm hoping that they're going to come together, work out whatever problems there are that has resulted in this, this rescission of the extension. And if that means I need to make some changes to the term of the extension or something like that, then I think, we'd be supportive of those folks doing what they need to do. But we are principally focused on providing the decision makers the information on the importance of this funding and the impact of losing that funding. And let me make a comment about that. We're probably not as concerned that the entire waiver just goes away as we are that important progress and determinations that are embodied in the extension that was granted before are lost in this new consideration of extension. There is something called budget neutrality. And it's basically a formula that the federal government uses to determine how much of our Texans' taxpayer money that we've sent to Washington will be available back to us for this purpose. And that budget neutrality determination that was made 6 months ago that we think was very positive for Texas and very helpful for Texas, that could be lost. So it's not a matter of all $10 billion a year being lost, but it could mean the difference between 10 billion and 8 billion. That's a $2 billion difference. That's significant.
And so you're saying the prior administration approved a higher level of, reimbursement for uncompensated charity care than what the current administration, the Biden administration, has proposed?
Yes, so no, the Biden administration has not proposed anything yet.
Okay.
But Texas went to the feds last year and said, let's extend our waiver. And you have a formula, Mr. Federal Government, that determines how much money could be available to us in the waiver in the future. And it's based upon recent experience here in Texas. Let us give you the numbers. And these are complex formulas. These are big data sets. But they presented the numbers to the federal government. They negotiated with the federal government, and they came to agreement on all the inputs into that formula and how the formula would work and what the result would be. That is what's up in question now as you negotiate another extension. That was settled. It was settled that Texas would have access to, a little more than $10 billion a year. That's no longer settled. That creates uncertainty for hospitals that are in trying times, and you want financial certainty so that you can make investment decisions, that you can make expenditure decisions, and not have to reserve money because you don't know what's going to happen to you.
And so, do you happen to know what the status is of conversations?
So right now, I think this week, Texas is concluding a series of public input processes that allow members of the public and organizations to give input on their waiver, to express their support for it or to express a desire for change, because there's a lot of detail in these waiver extensions. In this waiver itself is the details of a lot of programs to assist Texas with its charity care problems. So after that, those processes are finished this week. Texas will wrap that information up. We'll send it up to Washington with a request for extension, and then those discussions will ensue. The reason the federal government cited for denying or withdrawing the prior administration's extension was that they determined that the prior administration erred in allowing Texas to go forward without as extensive a public input process as would normally be done. And that was due to timing and the need to get certainty behind funding to hospitals so that they can feel comfortable to go ahead and spend money on pandemic response efforts. So it made a lot of sense. But the Biden administration simply made the determination, we don't think that made sense, and we don't think it was allowed by law. So therefore, we're rescinding that decision. So Texas is now complying with those public input requirements. They will present all that information to the federal government. And we would hope the federal government would say, okay, you did your public input, go ahead and let's extend that waiver. If they need to have some discussions about changes, we hope they're minimal. And we hope the most important thing is they realize how important it is to get that extension back in place as fast as possible.
So you really think this comes down to public getting input from the public?
Well, I don't know what all actually goes into that. That is the reason that the Center for Medicaid Services gave for rescinding the extension. There were reports in media outlets that there was actually a belief that if the waiver extension was withdrawn, that Texas would be forced to expand Medicaid enrollment, Medicaid eligibility. Well, the legislature didn't go along with that. The legislature didn't agree. And in fact, one thing we've been doing is educating folks just how much that kind of one versus the other decision-making doesn't make sense. In fact, the waiver, if extended, is a foundation on which enrollment expansion could be based upon. If you did enrollment expansion, if you expanded Medicaid under the Affordable Care Act, but you denied this waiver, you didn't have the waiver in place, it would undermine the effectiveness of that enrollment increase because you, and I guess the real bottom line numbers here is there's about 5 million Texans that are not insured. And enrollment expansion would only get about 1.2 million Texans enrolled in Medicaid. You would still need funding for those other 3.8 million Texans. And so the waiver needs to stay in place regardless of whether there is enrollment expansion or not. So that's a big part of the education because there has been a lot of information reported. I can't vouch for any of that. There's a lot of been reports both in Washington and at the state level that members of the Biden administration felt it would help Texas make an enrollment decision to withdraw the waiver extension. I believe that was a miscalculation.
Right, because at least at this point, the legislature, didn't pass Medicaid expansion, and there doesn't seem like it's going to be on the special session call. Can you explain to me one more time, Don, why it is that you believe that if they don't restore this 1115 waiver, that even if Texas were to have expanded Medicaid, it would have undermined that?
So it's because we need funding for all, what do we have, 25 million Texans now? I don't know what the exact, I haven't looked at that.
Almost 30 million.
So about 25 million Texans. We need everyone to have a source to pay for their health care. And we know we have about 5 million Texans that are uninsured. Medicaid expansion would only include 1.2 million more Texans in the Medicaid program, leaving us still with 3.8 million Texans uninsured. If we were to remove funding for those 3.8 million, well, then now it's going to cost more per person for everyone that is insured. So Medicaid enrollment now actually provides less coverage than the 1.2 million it would if the waiver is in place. So overall, we have a collection of hospitals and doctors and ambulances. We have a collection that is our healthcare infrastructure, and it needs to be funded. And if you remove funding from one area, it costs more in the other areas. And so not having the 1115 waiver in place is going to increase the cost per person to insure using Medicaid expansion.
And what about people who aren't on Medicaid? You're saying it's going to cost people who have private health insurance more money. Is that right?
Absolutely. It's going to put pressure on the hospital rates that the insured pay. Absolutely.
And at the same time have a negative impact on the hospital's bottom line?
Absolutely. And even their viability. And so the hospital community, Texas will have to turn to its governmental resources, its taxing capacity to generate more money, or we lose more hospitals. Some areas of the state are not in a position to lose more hospitals.
Do you know how many hospitals have been lost or have had to close?
You know, I haven't seen, I don't recall that number recently, but I believe Texas has lost. I remember being told recently that Texas has lost more rural hospitals than any other state in the union over like the last 10 years.
And I think I've gone through my list of questions. Is there anything else that you'd like to say?
Yeah, I would just say on that last comment, sometimes when we think about closing rural hospitals, we think, well, that doesn't impact me. I live in a big urban area. Well, it does. And that's because when rural hospitals close, now when there is a medical crisis, that person is transported to the closest hospital, sometimes into the urban area. And that's a person without insurance or possibly without insurance, possibly without Medicaid enrollment. And so now that's a cost that local taxpayers can get hit with for that, paying for the health care for that person from outside the county. We need a good hospital system throughout the state, and everyone has a stake in that.
All right, Don Lee, President of the Texas Essential Healthcare Partnerships. Thank you so much for joining us. We appreciate your insight.
Yeah, thanks for having us.